So we're back. I don't know where we left off, so we'll just sort of
Look.
yeah, we'll just back up a little bit and we'll go back to the Parkinson's. So what I notice, it's hard for me to tell that you've got Parkinson's, quite frankly.
Well, it's been because of the neurologist I've been going to, I think. He told me early on, he says, if you'll do what I tell you to do, people will not even know you got it.
And let's go ahead and mention, because he was on Doc Talk actually 2 weeks
Yes.
ago. Dr. Harrison Walker does take care of you. He's a neurologist at UAB. But I notice what I see is this hand.
Mm-hmm.
I don't even see a
I'm
tremor.
not even conscious of it.
I don't see a tremor. I just see a sort of an unusual posture
Mm-hmm.
to your hand.
Luckily, most of my Parkinson's is in my lower extremities, but does limit me to be able to use his hand very well. And seems to be now showing up on my left side now, and also a lot of muscle tone in my left ankle. When I have them wear off, it just, instead of tremors, it just clamps down, and it really is painful.
But I think the main reason I wanted you to just come on this is if there's any folks that have Parkinson's and have prostate cancer and have had a total prostatectomy, it would be nice to sort of get that group together in terms of, well, how are you doing with your prostate treatment versus another? So
I'm wondering if, once you're a Parkinson's patient, you're always a Parkinson's patient, even if you've had the DBS surgery. I think sometimes that maybe the DBS surgery could improve the incontinence problem. I don't know, but
that's interesting.
That would be,
yeah.
Whereas if I could have the DBS surgery, maybe my quality of life wouldn't be so bad, having had the prostatectomy.
Right.
Prostatectomy.
I wonder if you could do the planned treatment. It's radiation and chemotherapy. Is that right?
Well, it's radiation and hormone blocking.
And
Testosterone
hormone blocking.
Basically,
and then potentially get the DBS surgery.
Mm-hmm.
And maybe they could do like some urodynamic studies on you, and maybe then say, hey, maybe he will do okay with the prostatectomy.
Well, once they radiate the prostate, it's nothing but scar tissue left anyway.
I see.
There won't be anything really to.
Gotcha.
Wouldn't be anything really to take out. My concern, and I have looked up on the internet as well, that not necessarily the chance of survival of longer period, but the chance of recurrence is less if you do begin with the hormone blocking therapy first before the radiation. You wait a couple months and then start radiation. That's what I've read.
Okay. Well, that's not my field of expertise, but hopefully we'll get a urologist on one of these days.
I'm one that does a lot of
research.
Research.
I think a lot of patients are like that,
That's the internet.
Yeah, that is. In fact, I'd like to do a show just where we get on Google and we start looking things up.
That's the whole point of this show, anyway, is to educate. Right?
Yeah.
We want to put this
think
message
about
out
how it
there.
was 20 years ago, or maybe it's about 20, 25 years ago. It's amazing.
I appreciate you doing this for me.
Oh, no problem. I'm glad to do it.
I hope things go well, of course, and I hope information comes to light for you.
Well, thank you so much.
Appreciate it. Okay, thanks.